As a reminder, please don't play the live version simultaneous to this while you're on this call. As a reminder, please don't play the live. Oh, that's that. All right, we are recording.
Okay, Michael.
I'm all set.
Okay, we'll call the Human Services Committee to order at 9 a.m. And we'll start with Joanne. Now, Joanne, I just had a question on those first two resolutions. The contract dates are, the first one has an ending of September 30th of this year, and the other one ends at the end of this month.
Yes. So we realized with our STSJP, the supervision, yeah, I should know what this stands for. Supervision and treatment services for juvenile program, that there was money that was going to be unspent in another program. And so we were able to give probation that additional money to cover some more of their expenses. So that's why it has already ended. For the first one, the authorization amendment to the interdepartmental cooperative agreement with Schuyler County Probation for supervision and treatment services for juvenile program.
Tim, I'm just seeing like a stripe down the middle of my screen where you're sharing.
Okay, let me try it again. And that's, for some reason, I think when we're recording, it doesn't let me switch screens. How's that?
There we go.
Yep.
That's good.
Okay.
So actually, we just got our new allocation for, which started October 1st, but we just submitted our new plan for this. So there'll be another one resolution probably next month to do for this program for the new year.
Okay, so this one is the
It's
supervision and treatment services for juveniles that were
Yep.
switching to the probation department.
Yep.
Have a motion on that one?
I'll move it. Randonaro.
Second, Harp.
And then our next one is a contract.
Just a second, Joanne.
Oh, I'm
All
sorry.
Other discussion, all in favor?
Aye.
Aye.
Okay, any opposed? That passes. All right,
Then the next is to authorize a contract with the Salvation Army for the residential program for victims of domestic violence services. I'm not sure why this wasn't done in January, other than we may not have had our allocation yet.
okay. Do I have a motion?
I'll move it.
Second, Harp.
I got a question. Joanne, where are the people housed that this program takes care of?
In Elmira.
Okay, that's what I figured.
Any other discussion? All in favor?
Aye.
Aye.
That passes also.
Authorize an ongoing contract with the SWMN Communications, Inc., do business as One Call Now for appointment reminder services. We're just getting this set up to be able to remind people of their appointments so that we're not having people no show and then having their recertifications or whatever not be done and them have the potential of losing benefits and having to reapply.
I'll move it.
I'll second, Harp.
Any further discussion? It seemed to me, I guess we have contracts through mental health that are similar to this one, but this is the first one for the actual client appointments.
Well,
I think-
Sorry, Joanne, it says renew in
Yeah,
the,
this is a renew. We set it, we're just finishing setting it up. COVID kind of set us back this year. So, and then going forward, we'll be actually doing reminder appointments. And we can also send out other messages if we needed to, such as if there was a building closing or something like that.
Okay, all in favor?
I,
Opposed? That one passes too.
what happens if you guys go over 1328 active clients?
Then the actual cost goes up, but right now I think we should be fine where we're at.
Joanne,
Yes.
a question. Have you seen an uptick in domestic violence reports?
I know of a few that have come through children's services just in the last few weeks, but I wouldn't say I've seen a big uptick in domestic violence reports. I have not talked to Catholic Charities as to what they're seeing at this point in time, though, and usually they go there, and then Catholic Charities places them, and
Yeah.
then we pay the bill. Is kind of how that works.
Okay, yeah, thanks.
Yep. And then the last resolution is to authorize a transfer of funds for preventative services from family assistance.
I'll move it.
Second,
And any further discussion? All in favor?
I,
aye.
Any opposed? That passes also.
And then I have a motion to renew the contract with Cornell Cooperative Extension Association for the facilitation of the parent education program. It's at the same cost as 2020.
I'll move it.
Second,
Brendan Earl.
Further discussion? All in favor?
I,
aye.
Next is to renew the contract with Economic Opportunity Program for the Home Energy Assistance Program, certified services at a cost of $5,000, which is also the same as 2020.
I'll move it.
I'll
Brendan
move
Earl.
it. I'll second it.
That was Van again.
Yes,
Any further discussion? All in favor?
I,
The next is to motion to renew the contract with the Finger Lakes Area Counseling and Recovery Agency, Inc. for the qualified case manager at a cost not to exceed $61,557. And this is an increase of $595 from 2020.
I'll move it. Brendan Earl.
I'll second it. Harp,
Further discussion? All in favor?
I,
And then H is a motion to renew contract with Glovehouse Inc. for local foster care and placement home finding services for a cost of $59,015. And this is a reduction of $303 from 2020.
I'll move it. Brendan Earl.
Is there a
second, Harp,
further discussion? All in favor?
I,
aye.
I is a motion to renew the contract with Glovehouse Inc. for the permanency specialist for foster care placement at a cost of $74,150. And this is a reduction of $429 from 2020.
move it. Brendan Earl.
Second. Joanne, why was the reduction again?
It actually came from Glovehouse when they submitted their budgets to us. You know, we
I gotcha.
asked for flat budgets, but they went back. I think they had some changes in their health or some of their fringe benefits.
Okay, okay.
We're on to J, which is.
Yep. Motion to renew contract.
Joanne,
they
I'm sorry,
vote?
Mike, did we vote? Yeah,
Yeah,
I
that's
don't
what I
believe it.
was.
Okay, yes. All in favor?
Aye.
That passes.
Thank you.
J, a motion to renew contract with Glovehouse Inc. for persons in need of supervision, PINs, diversion services for a cost of $149,581. And this is a reduction of $58,706. And this reduction is actually a reduction in staff. There was one less person.
I'll move it, Rondinaro.
I'll second as Harp.
Any further discussion?
Yeah,
These people at Glovehouse, are they strictly working for Schuyler County?
Yes.
Okay.
and do we anticipate that that's going to cause any difficulty having that one less person available, or?
Not at this time, no.
Okay.
I mean, there may be in the future the need to increase, but at this point, no. The caseloads are such that not having that person is okay.
No further discussion? All in favor?
Aye.
Aye.
Motion to renew contract with GTL Inc., do business as Link to Life for personal emergency response services at a cost of $50 for installation and $28 monthly service charge. And this is the same cost as 2020, and this is paid through Medicaid. This is not a DSS actual direct cost.
I'll move it.
I'll
Harp.
second Rondinaro.
Just to clarify, so this is per installation, so each person that has the device, these are the charges every month, $28?
Yes, that's billed to Medicaid.
Medicaid, right. Any further discussion? All in favor?
Aye.
Aye.
That one passes.
Motion to renew the contract with the Schuyler, Steuben, Chemung, Tioga, Allegheny, BOCES, do business as the Greater Southern Tier GST BOCES for tests of adult basic education for temporary assistance and supplemental nutrition assistance program, SNAP, at a cost of not to exceed $10,000. It's the same cost as 2020.
I'll move it.
Second
Harp.
Rondinaro.
Discussion on this one?
Yeah, so what have we seen in the past? Are we approaching the 10,000 on this
Well,
line, or?
This year, not, because they had stopped giving the test for most of the time. They are just starting to re-give the test, but we're okay money-wise right now in the next year with the cost. I think we were at about 7,000 or 8,000. So.
Okay, thank you.
Motion to renew the contract. Oh,
Did we vote that one?
no, I don't think
No.
so. I'm sorry.
All in favor?
Aye.
Aye.
Opposed? That carries. All right, now we're down to the last one.
Yep, sorry about that. M, motion to renew contract with Weber CPA PLLC for forensic accounting services at a cost not to exceed 20,000. And this is the, or 12,000, excuse me. This is the same cost as 2020.
I'll move it, Rondinaro.
How many cases did they work on, Joanne?
Last year, they worked on one large big one. It was really, so for adult protective services, there's a grant that covers those costs. These are costs that for fraud, sometimes cases come up in
Yeah.
the service.
Yeah.
And what happens is the person may be, it looks like mismanaging or abusing an elder, but they also have an open fraud case. And so we have used them to help us go through all the bank statements and all the details to build the case to charge them with falsifying or not reporting income. Because
Okay, yeah, thank-
Yep.
Yeah, I got it.
Okay. And then the
Did
statistics.
we didn't vote
Oh,
that.
you didn't vote. I'm
We had a
sorry.
second.
We need a second, right?
Gray, a second.
All right, any further discussion? All in favor?
Aye.
Any opposed? That passes too. Okay, on to the statistics.
I wouldn't say there's anything that's a great big variance other than in October and November, our cases are probably, as far as children's services go and hotlines, are up to where we were pre-COVID. We're definitely getting many more hotlines, and the cases that are coming in are definitely more severe. We've had 2 children hospitalized in the last 2 months from abuse cases. So luckily and fortunately, both of those children have been discharged from the hospital and at this time appear to be doing okay. The one is an infant, and the extent may take some time to actually see if there's any lasting ramifications from it. So, but I would say those are probably the 2 biggest concerns right now. Also, we are in code blue, and I think we have 5 code blue cases right now out of, I just looked at the board and I forgot to count, but I think in December right now, there's probably 15 people. We have a large family that lost their home, and they should be rehomed fairly quickly, I would think, in the next, right after the new year. They should be able to have a place. So
I got one question, Joanne. The Medicaid number, if you look across the entire year, has been trending up, and 2020 year to date over 2019, well, actually, its monthly average is 888. So it's basically 50 up over
right.
the course. What's
And probably people losing their job and their health insurance
okay.
are coming in now for Medicaid.
Yeah.
But they may not qualify for TA or because they may be getting unemployment, but they would be able to potentially get Medicaid.
Yeah.
Depending on different things, but yeah.
Does that count people who are getting Medicaid through New York State of Health, or is that not?
No, this is just what we're doing here. So those are, for the most part, the New York State of Health is doing most of the I would say generic cases, the ones that are just flat Medicaid. The ones that we have are the more intricate, the chronic care cases, the ones with disabilities, the ones that have spend downs because they are over income, but they have medical expenses. And if they, spend a certain amount, then they are eligible for Medicaid. So.
Okay.
Anything, other questions on statistics? And then the budget, we're pretty holding the line on expenses as much as we can. I would just point out, we will be definitely underspent in the MMIS. This is just a reminder, this is our weekly Medicaid share that we must pay the state. And it went from around 69,000 down to 61,000 with the federal government's infusion of more FMAP money. So that's the difference. And that goes through April 1st or through March. So And there may be more if the federal government decides to do that. But at this point, it's at least through the first quarter.
The 2021 budget does reflect our estimate of not only applying the savings, but with somewhat more of a reduction as well. So we did incorporate that into 21.
Good job.
So,
Do we have any other questions for Joanne?
and then I just have one more motion underneath the Youth Bureau. The motion to renew the interdepartmental cooperative agreement with Schuyler County Department of Social Services for the Summer Youth Employment Program at a cost of $47,000, which actually was an increase of $4,000 from 2019. This is our summer TANF program, which we did run. We just need to make it official between the two agencies.
I'll move it. Rondinaro.
Second it. Harp.
Further discussion? All in favor?
Aye.
Opposed? That passes.
And then I just have one other thing under the Youth Bureau. We did receive notification that WGI through the NASCAR Foundation is donating $1,000 to the Youth Bureau for its work with youth. So we should be receiving a check, I think they said within the next 4 to 5 weeks for that.
Okay, anything else for Joanne?
No.
Thank you, Joanne.
Thank you. I wish you all a happy holiday.
Thank you, Joanne.
Good job.
Merry Christmas to you as well.
Merry-
Thanks.
Merry Christmas to you, Joanne. Thanks. Good job.
Okay, let's move on to Office for the Aging. Tammy?
Good morning.
Good
So
morning.
I have a couple of motions. The first is to renew our contract with Bethany Retirement Home, and that's for a social adult day program. That's at a cost of $48 per day. And then the transportation is $21 each way. And that's a total not to exceed $10,363, which is the same as 2020.
I'll move it.
I'll move it.
Rondinaro. I'll second
Okay.
Rondinaro.
Any discussion? All in favor?
Aye.
All right, that passes.
Okay. Next is the motion to renew the contract with the Schuyler County chapter of NYSARC. Doing business is the Arc of, that should say the Arc of Chemung-Schuyler for transportation coordination and mobility management training at a cost not to exceed $6,000. And again, the same as 2020.
I'll move it. Harp.
Second Rondinaro.
Any further discussion? All in favor?
Aye.
Opposed? All right, that passes. Anything else for us, Tammy?
Yeah, I did have a couple of things I wanted to let you know. So we were looking at the statistics for home delivered meals and knowing that we've been delivering many more meals. And at this point, we're comparing January through November of 2019 to 2020, and we have a 40% increase. And then if we break down a little bit, looking back in April of this year is when that really took off. We went from January to April, we had a 57% increase. And June and October, for whatever reasons, were really high numbers. I'm not exactly sure why that is, but we'll look a little more at that. We do have several volunteers who are helping with this, so that's been very, very beneficial for us and being able to meet the needs, getting all the meals out, because the paid routes that we have, they can only spend so much time getting the meals out there, so we can't really expand those routes. So having the volunteers makes a really big difference. Currently, I believe we have 9 volunteers who are helping to deliver the meals. And we have a total of 50 active volunteers who recruited specifically under Office for the Aging. and then an additional 38 volunteers who are registered under RSVP, but are coordinated by Office for the Aging for very specific services here. We have a couple of new programs that have taken off. One is Hello Neighbor, and that's addressing the social isolation and the loneliness. We're seeing a lot of issues along those lines, so having volunteers willing to call people is making a pretty significant difference in the lives of a few people. And then shopping assistance, we have volunteers who are going to the store and picking up groceries and taking them back to individuals, or they're taking the individual to the store and helping them shop, because not everybody can reach things off the shelves or pull open heavy freezer doors, that type of thing. So they're helping out that way. And we are looking to launch a pen pal program. We're doing that both via email and snail mail, and then setting up some lifelong learning opportunities for people. So there's more to come that way. We have been very fortunate to recruit a number of volunteers who have specialized areas, education and medical and different areas like that. So there's a lot to bring into that. And then the other thing is, for Thanksgiving and Christmas, we've had volunteers sign up to call people. So on Thanksgiving Day, a number of volunteers called people just to check in, make sure that they had somebody to talk to for the day, because a lot of people would not be seeing anybody at all that day. And we're doing the same thing for Christmas. We have quite a few people signed up to receive those phone calls. And
Very
then,
nice.
yeah, it's been really good. The addition of this volunteer coordinator is making a significant impact. So we're getting a big bang for our buck on this one.
Superb. I wanted to ask one question on the lifetime learning piece that you were discussing. Is that planned to be implemented once in-person gatherings, or are you actually looking at doing some of those virtually?
We would be starting it virtually.
Cool.
So looking at getting something going probably by February, maybe the end of January.
Nice.
And when we can be in person, we'll definitely open it up that way.
Hey, Tammy,
Go ahead.
Yeah.
Dan.
is anything being done to record any of those interviews for lessons learned type of thing going forward, to be able to improve the care, or kind of refocus it in a little bit of a different direction? I mean, basically learning from the information that we're receiving.
We are collecting data, and things that I will be doing is with the advisory council to get input there to look at that. We're also in the process of conducting a community assessment. We've been doing that over the past 6 weeks. We're continuing that. We have volunteers calling individuals and doing some interviewing over the phone to collect that information, and then where we're just handing it out hard copy format, they can fill it in and get it back. And Peggy just created a fillable form out of that, so we can get that out. We'll put a link on our Facebook page. We'll have it located on our web page, and people can go directly there and fill it out and be able to email it. So we'll be pulling all of that together, looking at where we've already been, what we've gone through, how things have changed, and then how do we use that going forward.
Okay, all right, thank you.
And then I had just one other area, and wanted to let you know we were contacted by the state office to ask if we would be willing to take on a new initiative. They had a pilot project for this and had 4 regions already set up. They've been through about 1.5 years of this now, and they're looking to implement 4 new regions. And this is called SHINE. It is SNAP Ed education. And the goal is to target low-income older adults who are eligible for SNAP and talk to them about better ways to use what they have available to them, teaching them how to eat healthy on a limited budget. And so it's all around the educational component. It will include a specific evidence-based class that will be offered. And then in addition, we'll be, when we can, setting up some food fairs and some food distribution. So in order to do that, we will be looking to hire somebody. So when I have all of the details together, I'll be coming back to you with that. We're probably not getting the application for this until January, mid-January, they're hoping. So once I have that and I have all of the particulars, I can bring that to committee next month. But this is not just for Schuyler County. We have been asked to cover the region. So this would be Schuyler, Chemung, and Steuben. And the reason they targeted Schuyler is because our poverty level is so much higher. So more to come on that.
Sounds good. Sounds like a great program.
I think it will be very good.
Okay. I just want to say that that's a very encouraging report as far as what you've been doing with the volunteers. And I mean, it seems really clear how difficult this is for senior citizens that are just isolating, and it's tough, especially at this time of year.
Very much so.
Thank you for taking that initiative.
Absolutely.
Anything else?
Nothing from me. So Merry Christmas to all of you.
Merry Christmas, Tammy.
Thank you, Tammy.
Tim?
Merry Christmas.
Tammy,
Yeah.
have a Merry Christmas.
Thank
Joanne,
you.
I apologize. I had my thing muted, but I did wish you a Merry Christmas.
Thank you. Tammy, maybe we could talk about that SNAP initiative when you get more to help
Absolutely.
identify people.
Absolutely.
And I would suggest also, Tammy, that you at least communicate with Cooperative Extension, because they're doing a program that also is focusing on SNAP clients for healthy eating education. So they may have some at least pointers, tips, something like that.
Yeah,
Right.
actually, we will be required to partner with them. We can't, for whatever reason, we can't utilize their educator. I think because maybe their focus, my understanding is, if I have this correct, they're focused more on the younger population and we're focused specifically on 60 and over. So
Right.
maybe that's why, but yeah, we will be required to partner with them.
Very good.
Very good. All right, we will move on to public health.
Thank you, Mr. Lascelles. So I'll start my report off with giving you an update on where we're at with COVID-19. So the report going out this morning, yesterday we received 6 new cases, bringing our number of total positive cases to 456. 53 cases are active, 195 under a quarantine order. We've had, unfortunately, 8 deaths, and we had 1 person in the hospital as of yesterday. For this morning, we've received 5 additional new positive cases, 1 of which is currently hospitalized. So our report tomorrow will show 2 hospitalized patients. Lots of movement with COVID vaccine. And if you're watching the news, it sounds like it's imminent to be here. However, I would encourage people to be patient because it's it's going to be rolled out over several months. We learned last week that the vaccination of our nursing home staff and our nursing home residents would be done through the federal partnership with pharmacies, CVS, Walgreens, Kinney's, and 1 other. There was maybe some confusion at first because the hospitals and the nursing homes weren't aware of this plan by New York State for the federal partnership. But those details seem to have been worked out, and the residents and a portion of the staff at Seneca View will be receiving their COVID vaccinations through CVS, and they'll be starting to receive those next week.
Deb,
Yes.
I just have a question. If
Sure.
somebody tested positive or had COVID, that in the nursing home, will they still give them that vaccine or will they not?
So there is no contraindication to getting the vaccine if you've already had the virus, but they would not administer the vaccine while they're actively sick.
Okay.
At this point, because we don't know for certain how long the immunity lasts after active infection, right now they're using a 90-day window, then my assumption would be for those higher risk individuals, including nursing home residents, they would not delay. If they've, a month ago had a positive test, they will probably get their vaccine now. For the general public or some of the other essential workers, what I have seen is that if you've recently tested positive, you could choose to wait until closer to the 90-day window and let someone else get your vaccine. But there's nothing that will prohibit people from getting their vaccine if they've tested positive in the past.
Thank you.
Mm-hmm.
I have a question on that also. At the fire department, the chief was saying that in the first group, certainly EMTs would be getting it, or members that are more likely to be closer to the patients. But it sounded like it will happen over a number of weeks. So like in a certain week, you may try to get it. They'll have given them all to other responders. So you might have to wait for another week to try.
Right.
And so do you have a sense of when they'll decide, okay, we're going from 1A to the 1B category?
So I don't. As you may be aware, late last week, the governor announced the regional hubs. And so our regional hub for the southern tier is United Health Services out of Broome County. And on Friday, they requested that all of the county health departments in the southern tier submit their COVID vaccine pod plans to them, which I did. They are now working on developing a regional vaccination pod plan or distribution plan. And they have called a meeting with us for this afternoon. So I may know more information after this afternoon, but I think that there's still quite a bit of information yet to come from the chamber and from the state health department. What they told us yesterday by the state health department is that for group 1A, which does include the emergency medical service providers, medical examiners, coroners, funeral workers, and then congregate settings, including OPWDD, OMH, and OASIS. The responsibility and the vaccine for those individuals is going to the hospitals. But the hospitals will not likely have enough vaccine to vaccinate everybody in 1A with their initial shipments. So there'll be multiple shipments before they can vaccinate everybody that's eligible in 1A. And the hospitals are prohibited from moving to the next group, which is 1B, without getting approval from the state health department and the chamber. So the other thing is we want to be careful that not everyone in those key roles is vaccinated on the same day. So even at the nursing home, they will not be vaccinating all of the staff on the same day, because then if they have individuals who have, the adverse events, which might be mild, but might be enough to keep them out of work that day, that they have a fever or they're fatigued or they have a headache. So they won't want to vaccinate all of the first responders and EMS folks either on the same day. There's still a lot that I think the hospitals are learning. There was a call with the hospitals and the state last evening, so they probably have received more information now regarding how they will be rolling out this vaccine. They are going to be required to use the state's CDMS system for scheduling individuals to get their vaccine and for the reporting of the vaccine to be administered. To be honest with you, I'm a little concerned about that approach because we've been using that system at the state health or at the local health departments. And the hospitals haven't. So, you know, there'll be a little bit of a learning curve for everybody to learn how to use that system and then to get people registered to come and get their vaccine.
To follow up on that, or to add to that, there's a significant amount of frustration at the county level, public health departments in particular, with the lack of involvement. Public health departments, by mandate, train for this annually. They're the best equipped and have the most knowledge, not only of the procedures, but as to the community itself and who should get it. Whereas hospitals have no experience in this area, yet county public health agencies are pretty much excluded at this point from the process, and it's being hospital driven. The hospitals are now turning to public health to learn. I think the best we can hope for is there's going to at least be a partnership, but it is frustrating. And I know I speak for many counties actually that this is, the resources that we have, the experts that we have aren't being utilized from this. I did forward the legislators the guidance document that came out from the state yesterday with each one of the categories, so you can get more specifics drilling down into that as well. But suffice it to say, there's a high level of frustration at the county level with the the state's directives and at the exclusion of the counties in this. So,
Deb,
Yep.
I have another question because I've been asked this by our staff, especially our services staff that's going out into people's homes, where they land on this list, and whether or not they're prioritized at all, because they're mandated to go.
Yeah, I couldn't even begin to answer that question, Joanne. The chamber is keeping this very tightly closed, and they are not releasing information with any advance warning. So the folks who are listed as eligible for 1A, that was released around midnight on Sunday, effective yesterday. Public health workers who are, whether it's state or county, public health workers who are out in the field swabbing individuals and doing the COVID testing are still not listed as in any of the priority groups. There's been concern voiced on the part of the local health departments that, how do we ask our staff to continue to go out and meet with these individuals who are symptomatic and swab them, or begin offering COVID vaccine, but yet the persons administering the vaccine are not offered it. So just a terribly frustrating situation, and I wish I had better answers. I would caution folks to be very, very skeptical of information provided that does not come from either your provider's office, the hospital, or the health department. I think that there's a prime opportunity for people to be taken advantage of, to be told, if you pay X amount of dollars, you'll get on the list to get a vaccine, or, we've got available vaccine, you just have to pay for it up front. This vaccine will be offered at no cost to everybody who's vaccinated.
One question about the pod, then, is that going to be at Schuyler Hospital?
I didn't hear the beginning of what you said.
You said that you had submitted a plan for our pod. I assume you meant for the vaccination. So is that going to be hospital employees or public health employees at the hospital? Or
So as Mr. O'Hearn had mentioned at the local health department, for years we've had to plan for conducting pods, whether it's to vaccinate people for H1N1 flu or hepatitis A, or administer antibiotics, or now in the case of COVID vaccine. So we do have plans, and we have locations identified in our community that we would hold the pods at. So this includes places like firehouses, Watkins Glen International, the Human Services Complex, et cetera. Because we don't know what part of our plan they're going to use. I don't know where these initial pods will be held, but I would expect that it will be at the hospital.
thank you.
Tim,
We
are
also
you?
don't know if our staff will even be involved either.
Right.
So,
Tim, are you in communication with NISAC about this, just to see if they can drive some lobbying or something to say, what the heck are you guys doing?
yeah, actually, the information that I just shared came from a joint call with NISAC and NISHO yesterday. So NISAC was not aware of this from the responses, or my take on this, or was not aware of how severe it was until hearing from the public health side. Yeah, NISAC, I'm assuming, is all over it at this point.
Thank you.
Deb, you were on the call. Would you agree?
Yes. Yep. And so one thing that I do want to say is that here in Schuyler County, we have a wonderful partnership with the Schuyler Hospital and Cayuga Medical Center. And so we've been having weekly calls to discuss our vaccination plans specific to here in Schuyler County and how we will work together. So despite what is happening at the state level, we're going to continue to partner together and do what we need to do, both through the hospital and through public health and through emergency management, to get the vaccine out to our population here.
Good point.
So if there are no other questions about COVID, I would just move on to my action items.
Yes, sounds good.
Okay. So as I hope all of you are aware, I am going to retire at the end of February. And so Yates County has moved forward with hiring a new director of public health who will take over the ship at the end of February. So her name is Anne Marie Flanagan. She is a former public health employee that had worked under me a number of years ago as a public health nurse. And then she left public health to go on to get her nurse practitionership, and had continued with her education to get a doctorate in nursing education. So she has been working as both a professor of nursing studies and then also as a family nurse practitioner, and comes very well qualified to serve as the director. She will be starting to work with me in January, on January 5th. She'll work about 20 hours a week with me throughout the month of January. In February, she will move to 40 hours a week, continuing to work with me through the transition. So I'm sure she will be joining me with many of the meetings that we have here in Schuyler, and will be actively working to introduce her to the legislature, the other department heads, and the processes here in Schuyler County.
Tim, is this going to have any budgetary impact, and is it something that we can just handle through contingency?
Actually, we should be able to absorb it through the public health budget. Part of it is aidable, and we're not talking about, huge increases in expenses. So I think there's room within the budget to absorb this for the short time that we're talking about.
Thank you.
Okay, so in line with this, my first resolution that I'm requesting is to authorize amending the management confidential handbook and authorizing the creation and filling of a full-time deputy public health director. So
I'll move it. Rondinaro.
Second, Dan Hart.
Any discussion?
I can add to that. That's part of, it's something that we've hoped to be able to do for a while now. This opportunity has presented itself to move someone internally to the deputy position. That means we won't be paying Yates County for that shared position any longer. So there will be some cost savings that will be applied to the increase in this position. It also represents the elimination of a position to move into this one. It's not a net new staff person, just to be clear on that. We will be promoting an internal candidate, and with the eye on even future succession planning, and this may be our future public health director in years to come. So this is consistent with our succession planning, and it also gives us brings us in compliance with DOH requirement that there be a person in charge at all times in each county. So this is kills a number of birds with one stone.
So Anne Marie will still be the director for both counties.
Correct.
We will have a
Correct.
deputy.
Right.
And we'll make an appointment next month for the deputy?
Yes.
Any further discussion? All in favor?
Aye.
Opposed? That passes.
The next resolution is to authorize an intermunicipal agreement with the Village of Watkins Glen related to amending an existing lease agreement and an existing shared administrative assistant, public health, buildings and grounds. So this is for the shared work that one of the employees is doing. She is an employee of public health. She'd previously been an employee of buildings and grounds, and she does work for public health, the village, buildings and grounds, and highway.
I'll move it. Rondinaro.
Second, Harp.
Okay, is there any discussion? Jamie, there's an extra, I think in the first paragraph at the end, there's an extra, in the last sentence, it says, county's highway department at the county's shared public works facility, that there.
Well, Mike, I'll take a look at that.
Yeah, it's just at the last line of the first whereas.
Okay.
Any further discussion? All in favor?
Aye.
Any opposed?
Aye.
All right, that passes.
The next is a motion to renew our contract with Chemung County for the STD testing and treatment for Schuyler County residents at a cost of $2,000 annually. This dollar figure is unchanged, and this is a contract running from January 1 to December 31st.
So it's yearly cost? It's not based on how many tests are actually administered?
Correct. Mhm. And I will tell you, we are getting a bargain because we pay significantly more in Yates County when we pay per test.
For sure.
Good. Go ahead.
Move it, Rondinaro.
Second?
Second.
Okay, and then my last item is a motion to renew our contract with Stephen Maybe.
Just a second.
For,
We have
I'm
to-
sorry, I'm
Yeah.
sorry.
If there's no further discussion, all in favor?
Aye.
Any opposed? All right, that passes.
Okay,
Thank
sorry.
you.
So the last item is a motion to renew our contract with Stephen Maybe for engineering services in the amount of $200 per design, $100 per evaluation. And again, the cost is unchanged from 2020.
Do I have a motion on this one?
I'll move it,
So moved.
Rondinaro. Second, Rondinaro.
Okay, any discussion?
Yeah, engineering services, design of what?
These are for the septic systems.
Ah, okay,
So
Watershed.
your watershed.
okay. So is there any progress with, I can't think of his name right now. Who is our watershed?
Daryl.
Daryl getting his PE, so he would be, because that was one of the plans.
Right, he continues to work towards that, but he has not completed it at this point.
Okay, but he is actually doing the coursework to move forward.
I'm not sure that he's involved in any coursework right now. I will check to see how much more he has to go and report back to you.
Thank you.
Hey, all in favor?
Aye.
Aye.
That passes also. Do you have anything else for us, Deb?
I have nothing further.
Anything else to bring up from any of the legislators? I did have one question.
Negative.
I got a comment regarding how local reporting shows the places where people might have come into contact with someone that was positive in Steuben County and Chemung. And so, and I know we've discussed this before, but particularly when they see places within Watkins Glen on that list, people ask, why aren't we doing that? So I was just wondering where we're at with that.
So, that has been the approach that Steuben County has chosen to take. We've had many discussions about it, both internally and with my regional peers, and we've taken the stance that it's not appropriate to do that at this time. And in fact, there are several counties, not Steuben, but several other large counties who had been reporting every day these public places that people went to, and they have since stopped because they said it is not helpful. People need to understand that anytime they walk into a public place, they could possibly be exposed. It's community-wide.
Right.
And that the places that we're seeing people exposed are not these public places. They're being exposed in their own home or in their friend's home or in their workplace. So it's not walking into a Walmart or walking into a grocery store. We're not even seeing it at restaurants.
Mhm.
It's what people are doing in their own homes and in their workplaces.
Yeah, and to add to that, there is no efficacy, in doing that. And if you look at Steuben as an example, for those that say visited one of those locations, the advice is to monitor your health and contact your physician if symptoms develop. That should be happening anyways. And our position, simply from a public health standpoint, is treat everybody as if they're infected. If you protect yourself, it really, it doesn't matter where you go. on that, and don't go to places that don't follow the rules. But Steben's practice is, besides frustrating, it serves no public health purpose at all, other than to satisfy curiosity. And quite frankly, with the numbers they're experiencing, there's no way that they're accurately contact tracing and reporting locations. It's in some respects, it creates a false sense of security if you don't see your place on there. From a public health standpoint, we are absolutely doing the right thing. And I know there are some people that strongly disagree with that, but this is meeting the benefit of or looking out for public health, nothing more.
Right.
So.
No, I have to agree. I find it helpful to hear the explanation once more because I couldn't agree more.
Just raised my blood pressure 20 points.
Sorry.
Well, Deb, thank you for all your hard work and have a Merry Christmas.
And the same to all of you. Thank you.
Merry Christmas, Deb.
Very much. And
Thank you.
Merry Christmas. Merry Christmas, Deb.
Okay, let's move on to community services. Sean?
I only have one simple thing today. That's a motion to renew the contract with Schuyler County IT for services for the year of 2021 at the cost of $11,000. This is, as noted, a reduction of $14,000 from 2020. We had put in a variety of additional costs to help upgrade for the COVID process, including new computers and so forth. Our typical year-to-year amount with IT is $11,000, so that's why we reduced it back to $11,000.
I'll move it, Rondinaro.
Second, Harp.
Discussion? All in favor?
Aye.
Any
Aye.
opposed? That passes. Anything else for us, Sean?
Nothing on my end. Are there any questions for me?
Can you send me, that's a fantastic background. How did you get that?
I simply got on, I can email it to you. I simply got on and looked up Zoom free backgrounds, and then you save it to your computer and you just click on it and you can add it.
Gee, it looks like the view out my window.
That's partly why I got it, because for most of us, that's what it looks like right now. Instead of looking at my office, so you know. Any other questions?
Well, have a Merry Christmas, Sean. Thank you very much.
Merry Christmas, everybody.
Yep.
I do
Merry
appreciate
Christmas,
your
Sean.
background. It's really classy.
Okay, I'll entertain a motion to adjourn if there's nothing else.
So moved.
Michael, and then will you just reply with that personnel action form if you would for me, please? And are you okay with me signing on your behalf?
Yes, that'll be fine.
Okay, would you just put that in an email for me and I'll print it and attach it?
Okay,
Thank you so much.
you bet. Thank you.
Can we take a 10-minute break or 5-minute break? I've got something I've got to do on this end before we start CDNR.